Diversity Committee. The Pleasant Hill City Council presented the Civic Action Commission with the charge to work specifically on more diversity programs, activities, etc. for the city of Pleasant Hill. This community conversation idea came out of discussions with Brian Hill, Pleasant Hill Chief of Police, former Mayor Sue Nowak, and the Diversity Committee of the Civic Action Commission. This is a continued conversation from our summer of 2020 conversations with Chief Hill and Mayor Wren of where do we go from here, social justice in our community, mental health, faith life, youth, social justice, Asian American and Pacific Islander, Jewish, LGBTQIA, and plus in community conversations. We wanted to continue the conversation this evening and invite a few more community experts. And actually, we're bringing back some of our former conversation in regards to the youth. And this evening, we'll actually be talking about young people and mental health challenges and what can be done for those who are in crisis, considering everything that's been happening over the past few years. To start today's webinar, I will read brief bios from each of our panelists, and they will have 3 minutes to say a few words about their respective areas of expertise, or brief backgrounds from our students. We will also provide a link to more detailed bios of all of our panelists on the Civic Action Commission diversity section of the website. Throughout the webinar, all attendees will be muted, but will have the ability to use the Q&A feature available in the Zoom webinar on your screens to present questions. Once our panelists are finished speaking, they will answer questions that have been submitted in advance through the registration process and also questions that have come up through the Zoom Q&A and chat features. We will, of course, try to get to as many of your questions as possible within the next hour or so. I look forward to a very respectful conversation this evening. If you happen to miss any of today's webinar or want to watch any part of the webinar again, we are recording this session and the video will be posted on the Civic Action Commission's diversity webpage, pleasanthillca.org/diversity. At this time, I will now turn the webinar over to our esteemed panelists, starting with Tara Griffiths. Tara is a student at UC Santa Cruz studying neuroscience and history of consciousness. She was born in New Jersey and moved to Pleasant Hill when she was 8 years old. After a couple of years at Pleasant Hill Elementary, she moved to Basel, Switzerland, where she attended an international school for 2 years. After returning back to Pleasant Hill, she attended Pleasant Hill Middle School and then College Park High School. At College Park, she was an officer in the Gender Sexuality Alliance and in the Students for a Democratic Society. During her studies at UCSC, she is also working at a local pet store. She loves dogs. For fun, she likes to take her dog to the beach and go on hikes around Santa Cruz Hills. Tara?
Hello, everyone. Thanks, Lloyd. So yeah, I'm Tara. I went to school in Pleasant Hill. I went to College Park High and Pleasant Hill Middle, and I loved going to school here. I love the community, but that's not to say that being a student here doesn't come without its troubles. I've struggled with emotional and mental health issues throughout my adolescence and into adulthood. I grew up during this crisis of mental health illnesses and problems throughout the US in general. I've seen countless friends that have been troubled with mental illnesses such as anxiety, depression, eating disorders, OCD, undiagnosed ADHD, and I mean, the list goes on. I've seen it in family members, coworkers. I just hear about it all the time. Especially as a member of the GSA, the Gender Sexuality Alliance, during high school, I was painfully aware of how disproportionately these issues affected queer students or just members of the LGBTQ community in general. And within the GSA, we try to make the school more inclusive, a safer space for those students, but there's only so much you can do. And so seeing this and wondering why this was becoming a social norm is a lot of what pushed me towards getting my degree in neuroscience, working on my degree in neuroscience, studying history of consciousness, which is my minor. And all of that is even before the pandemic hit, which is most of what we'll be talking about today. So I can't even imagine like how the students of today in high school and middle school and beyond are dealing with this or below school, like staying motivated in school, staying happy and healthy as a child must be so much more difficult these days than it was before the pandemic. And that is most of what I have to say. I'm really excited to hear from the community today. I'm so happy that you guys are having me here. So thank you.
Wonderful. Thank you so much, Tara. I'd like to introduce Leo Lee. Leo is the NAMI Contra Costa Transitional Age Youth Coordinator. Lee moved to the United States in 2018, once struggling with cultural barriers, loneliness, and depression. Lee says that he has experienced a lot related to the cultural conflict shock and has also been deeply affected by it. Lee never has been officially diagnosed due to our cultural shame on mental health, so he wants to share his experiences with others, especially with new AAPI, Asian American Pacific Islander immigrants, to help them. He wants to let them know that they are not alone and there is no shame in living with a mental health condition. Leo?
Thank you. Hi, everyone. Good afternoon. My name is Leo Lee. I'm currently a Transitional Age Youth Peer Coordinator at NAMI Contra Costa. And I was born and raised in China. I live here for 16 years. And I moved to the United States in 2018. So that is like 4 years ago. And I've been fighting with depression, anxiety, and cultural shock from then. Right now, I'm studying at the local community college, Los Monanos College, for physics major. And to be honest, since the pandemic beginning, I can feel the anxiety and pressure coming back from my high school age. I can actually feel this pressure and like all the anxiety flowing back into my brain. This pandemic has really hit us hard. And to be honest, I think with all those things going on with the inflation and all the Ukraine war, the life we're living right now is way more different than before. So I think I want to share my perspective with all of you, maybe like to help others, maybe some patients who are suffering from mental health conditions. And especially my experiences in NAMI during this 1 year have really taught me a lot about how to treat and like talk with those people who are living with mental health conditions, especially my own experiences and my friends' experiences. I think one of my friends, she was also an immigrant coming from China. He moved to this country like in 2016, and he was trying to end her life just by a knife. So it is really hard, and right now the situation is really cool, and I think we need to do more, we need to act more. And what can we do? I think by talking, by communicating with each other, with our information, just sharing our experiences can help others. I think that's my motive, and I will keep doing so. Thank you so much. I'm really excited to be in this community conversation.
Great, thank you so much, Leah, wonderful. Now I'd like to introduce Tristan Siebel. Tristan recently graduated from San Francisco State University with a bachelor's degree in psychology focusing on child development. After experiencing many traumas in her life, Tristan has decided to utilize her lived experience to help those in the transitional age youth community overcome their feelings of depression and isolation. Her future plans are to continue working with NAMI Contra Costa as the Transitional Age Youth Coordinator and Human Resources Assistant, and potentially working with children in the preschool age range at NAMI after aging out of the Transitional Age Youth community. Tristan?
Hi, everyone. Thank you so much for that introduction, and thank you so much for having me. Yeah, just kind of like the bio said, I am recently graduated from San Francisco State University, degree in psychology, and I've been at NAMI Contra Costa for about a little over a year now, and it has been a wonderful and fulfilling time in my career to be able to really get a good idea of what it's like to be a transitional age youth with a mental health condition in this time, especially after the pandemic and during the pandemic. It's important to notice that, the BIPOC community has always had so many disparities and disadvantages put against them in regards to mental health. And as we have seen the suicide, depression, anxiety rates rise throughout the pandemic, and especially in the BIPOC and LGBTQIA plus community, I want to do my part and let them know that they are not alone. I am here with them, and that they can fight it and we can get through this together.
Wonderful. Thank you so much, Tristan. And now I'd like to introduce Alexander Towar. Alexandra will be a senior this fall at Loyola Marymount University, majoring in communication studies and is a member of the sorority Alpha Chi Omega. This summer, Alexandra is a transitional age youth volunteer coordinator intern. Prior to the summer, Alexandra worked side by side with NAMI and the Miles Hall Foundation. Due to her own struggles with mental illness and trauma, Alexandra has become passionate about ending the stigma surrounding mental illness and wants to find ways to improve the mental health system and help others in crisis. Alexandra is still exploring her options, but she's interested in pursuing law and one day judgeship. Alexandra?
Hi, thank you for having me. So yes, back in 2015, I 5150'd myself. I recognized that I needed to get help because I was at a really low point, and that entire experience was awful. And I didn't even realize it until years later, looking back. But we were definitely treated like our illnesses instead of people, which is extremely difficult, especially if you're dealing with mental illness. Like, you don't want people just treating you as one thing. Thankfully, I seem to be doing pretty well now, and I noticed that a lot of people are also struggling with mental illness, and I decided to finally come forward and begin being more open about it. And I've just noticed, especially in the last few years, everyone seems to be so much more stressed out. My cousin, she's 11 years old, she's biracial. She's worried about her father getting killed in the street when he's running or when he's driving throughout the neighborhood. She wakes up from nightmares about school shootings, and everything that has happened with COVID, the isolation, it's created I almost want to say kind of like growth within our youth. Like, everyone is carrying this new trauma with them, and it's one after the next. And I think that our schools especially need more resources. So yeah, I've got a lot of opinions. I've been through it all. So yes, thank you.
Thank you so much, Alexandra. Now I'd like to introduce Gigi Crowder. Gigi is the Executive Director of Contra Costa Chapter of National Alliance on Mental Illness, NAMI, the country's largest advocacy organization for people with mental illness and their families. Before NAMI, Crowder worked for 10 years as Alameda County's Behavioral Health Care Services Ethnic Services Manager, where she pushed to provide programs for Black, Asian, LGBTQ+, and Latinx people, and taught implicit bias training to police. A woman of great faith, she also chairs a statewide initiative to integrate faith and spirituality into mental health treatment. Gigi?
Oh, thanks so much for having me. And you see what a dynamic staff I have of young people, as well as, I'm not sure what your plans are after you graduate, but Tara, I am very impressed with what you're studying. So we started our work in Pleasant Hill in a hospital room at Crestwood until we got funding from the county. Because of the pandemic, and it's my belief that we're all suffering from PTSD. Some of us are managing it better than others, but because we all went through an unprecedented time with COVID, we all have to readjust. And so as we started reopening our offices, which we open and close, the bulk of phone calls were coming from parents who had young individuals who were really struggling with finding balance in their life. The social distancing, which we probably should have been calling physical distances. We should have been encouraging people to socialize safely, but we said physical distancing, which meant that individuals were more isolated. And so we started seeing its own large group of challenges from young individuals who, when it was time to go back into the classroom, a lot of them had fear. So I went to our board of directors and I said, I'm thinking we need to focus some of our attention and funding toward hiring transitional age youth. And for the definition, that's individuals between the age of 16 and 24. Because when someone is struggling, they don't want to hear from someone who's never been through it. We are really authentic at NAMI. We like to have individuals be able to say, I know exactly what you're going through. I went through it myself, whether it's from the role of a family member or as a peer. So when family members come into our office and they're talking, they see an example of individuals who have been where their young person is, but through support, and a large part of the support is community support. Each of these young people have talked about the fact that when we talk about it, we kind of normalize it. So I think all of us need to talk about how we're feeling so that we can get the people who are more silent to speak up so they can get the help they need. The youth-focused programs are called Ending the Silence, hint, and Knowing the Signs, hint. We know the suicide rates have increased tremendously. And as I think it was Tristan said, the calls we get from individuals from BIPOC communities, they're harmed in a way where they have a difficult time finding culturally responsive services that meet them where they're at. So we're working really hard at NAMI to have a staffing pattern consistent with the population and reflective of the population. Some of the calls we get are, young kids don't say they have a depression, but they do say they have a stomach ache. And if they're having too many of these stomach aches, headaches, and their body is sending messages that they're not doing well, we really need to be able to be there for them so that we can put preventative approaches in place. So I really appreciate the panel you're having, because I think it's really important for each city to be talking about this, but also coming up with a plan. So after tonight, instead of just having a discussion, the city of Pleasant Hill would say, and this is how we're going to address this. And NAMI wants to work right alongside you to, of course, support any effort, any young person that is having a difficult time. We definitely want you to let them know that there's a safe place. Tristan and Alexandra and Leo have ethnic and language specific transitional age youth groups that they could participate in. We look at the gaps, we look at the trends, and then we create services to try and fill the gaps and meet the need based on what we're seeing. So it's a community approach that we need. So all of you guys have been deputized officers. I hope it's okay to deputize them as change agents for improving outcomes for young people. Thank you.
Wonderful. Thank you so much, Gigi. And now Sergeant Christopher Anderson. Sergeant Anderson has been with the Pleasant Hill Police Department for 15 years. He grew up in Pleasant Hill, attended Valley View College Park and DBC. He holds a bachelor's degree in police management. He is a current team leader for the Pleasant Hill Police Department Crisis Intervention Team. He has done dozens of hours of training in communications, de-escalation, and crisis intervention. He was a task force member for the Silicon Valley Internet Crimes Against Children, Protecting Children Online as well. Sergeant Anderson.
Good evening, everybody. Thank you for having me. Thank you for the introduction, Lloyd. My name is Chris Anderson. I have been with Pleasant Hill, like Lloyd said, for 15 years. So in that time, I've seen some pretty dramatic changes through the public and through the way we as the police respond to calls for people that are in crisis, and just a dramatic change overall in the way that we train and we prepare. As Lloyd mentioned, I am the team leader for the Central Contra Costa County Crisis Intervention Team. Pleasant Hill is one of 3 agencies involved in that team. We're partnered with Martinez and Walnut Creek Police Departments to form an alliance between all 3 agencies so that we can get specially trained officers with additional CIT training to calls more available 24/7, 365. Everybody knows during the pandemic, we didn't stop. We were here. We didn't get a chance to shut down, so we kept coming. We kept picking up the phone and answering and coming. And I just wanted to kind of go a little bit over the focus of the CIT team, so some people may not understand what it is. CIT team members are collateral duty officers, meaning it's a duty that they have in addition to working regular patrol. And the focus of the team is to respond to individuals who may be in crisis, who may not necessarily be committing a crime, but pose a potential danger to themselves, their family, or even the public. Officers assigned to this team receive additional ongoing training with a focus on de-escalation and comprehensive listening. Officers work to render the scene safe. We coordinate with family members and those afflicted with illness to try to help get them pointed in the right direction to appropriate resources within the county. We are trying to build on the program, so we're always looking for ways to improve. We're always looking for ways to train in different perspectives. One of the big things that we're trying to, help smash a stigma around is the fear around police. I think in the last couple of years, especially with the additional training, the additional awareness of what's going on in the community, both with police and both with mental health, a big part of my team's responsibility is to help educate. So I highly encourage everybody here to submit a question, even if it's something about as silly as, hey, if I run a red light, what's going to happen? And, if I get a ticket, I'm here to help answer those questions. Your local police departments are here, but especially when it comes to people in crisis and what's going to happen. If I'm in crisis, I haven't committed a crime, but now I'm talking to a police officer face to face. Am I going to go to jail? Am I going to get 5150? What's going to happen? And I can help better explain how that process is looking in 2022 versus how maybe it looked in 2018, 2017.
Wonderful. Thank you so much, Sergeant Anderson. As well, June Catalano, the Pleasant Hill City Manager, and Mayor Michael Harris, our Pleasant Hill Mayor, will also be available during the conversation to answer any city-specific questions. Thank you so much, Manager Catalano and Mayor Harris. Would you like to say any words at all? Or?
If you don't mind, Lloyd, I'd like to first of all thank all the panelists. I think you're extremely courageous for putting yourself forward and trying to help others who have experienced mental health issues. I've been a professor of optometry at UC Berkeley School of Optometry for 50 years. And while I'm not involved directly in mental health, I am involved with working with youth and others. I was also the founding chair of the Contra Costa County Managed Care Commission, which ran the county hospital and the county mental health services. So even though I'm not a mental health expert, I'm aware of what's going on. And I have 4 kids and 3 grandkids. So I know what it's like to be a young person, even though it's been many, many years since I was. And in my estimation, what kids are going through, young people are going through today is much more challenging than anything that I've seen since I was a teenager myself. So I recognize the challenges, I recognize the opportunities, and I know that the city and all the other agencies are here to do whatever they can to help. And I appreciate being on this panel, and thanks, Lloyd, for putting this together.
Absolutely, thank you. June, would you like to say a couple words?
Just to thank the panelists. I think this is a great panel, and the staff at Pleasant Hill is always available if anybody has any questions or need anything from us. And again, thank you very much.
Wonderful. Thank you so much, June. Now I would like to open up the floor to questions. The Q&A portion will go till about 7:15 roughly this evening before closing our program. Because we have a large number of panelists and we want to make sure everyone can hear from everyone else, I would ask that everyone please try to keep your answers around 3 minutes or less. We want to make sure everyone has a chance to speak. I will have a timekeeper, and the orange box will appear with 15 seconds left for your time so you can begin to wrap up your thoughts and to help keep everyone on track. Thank you so much. So actually, to start our conversation this evening, I know that a couple of folks, I think Tara and I think Alexandra had mentioned 5150. What does that exactly mean, just for folks out there? Because I don't know if everyone actually knows what that is. So just wanted to kind of clarify that to start with. And anyone can answer that.
I suppose I can answer that question. A 5150 is a detention that's outlined in the Welfare and Institutions Code for California. Any clinician, physician, I believe psychologist or psychiatrist, or a police officer can place an individual on a 5150 hold. And what that means is that is just the authority that gives those individuals, including officers, the ability to force somebody to go see a mental health professional in the psychiatric emergency services ward, specifically in Contra Costa County. So it may be somebody who's so deeply in crisis that they may not even recognize what's going on, or their reality may be altered. So it's a non-voluntary thing that happens, but occasionally people will place themselves on a 5150 hold without the need for an involuntary hold.
And I'll share the further definition as a person must be deemed a danger to self, others, are gravely ill. And so there's some struggles with the 5150 code, because you're pretty much saying you have to wait until the person is at their most extreme level. And some people challenge against forced treatment. And so we know that for young people, we were really challenged with the fact that our psych emergency services was the same portal as the adult. And so in this county, through a lot of advocacy, they're actually in process now of having a separate unit for children that we're really excited about, that should be up and running by next summer. So that's, children require a different level of care than adults, so they shouldn't be housed together, not even through the intake process.
Perfect. Thank you so much. So I want to bring up something that's just recently happened. I think everyone, well, hopefully everyone on this panel heard about the 988 mental health hotline, and kind of wanted to hear your thoughts, panel members, your thoughts on that, and is there anything that our local leaders and community members could do to help give more support where it's needed in regards to that?
Hi, yeah, so I am really, really excited about the 988 number, just because it's a non-crisis or non-police, it's not a non-police crisis response line, but what it is for someone to call the line and speak to someone who actually understands what they're going through and can help them through their crisis situation over the phone. So it's important to know that it's not a non-police crisis response number. That has been, I feel like it's been a little bit misconstrued as that, but it is there for people to call when they need just some services over the phone. And it's a wonderful thing, honestly. It's wonderful because it's cutting out that big, long number that people might be a little bit hesitant to call because they know the stigma around that number. They also know that dialing that number requires some memorization, because sometimes it's difficult for them to remember 1-800-273-TALK when they are in a mental health crisis. So 988 is just the perfect number for them to call. It's close enough to 911 that it's easy to remember, and it's also different enough to where they know that it's not the police crisis response number, it's their own mental health just crisis counselor number.
Wonderful, thank you.
I would like to share with that, and thank you, Tristan, for making that clarification. So we all celebrate the fact that 988 nationally is available. If you pick up your cell phones, most carriers now allow for you to call 988 and go in our county to our Contra Costa County Crisis Center. But here in Contra Costa County, we're also funding that and hoping that we will have AB, Assembly Bill 988, signed soon by the governor that would extend those services. So we will have a non-police response. We all recognize and we're really appreciative the collaborative effort that Pleasant Hill has joined in with Martinez and Walnut Creek, because there are going to be times when we need a police response. We utilize them because they can get to the scene faster than others, and we still will need that at some time for those who are living with mental health challenges and they have a weapon or there's an imminent danger. So that, but we also, thanks to Assembly Member Rebecca Byer-Cahan, have a bill in place that is now waiting to go through the Senator's appropriation. That would mean that when individuals, at least in Contra Costa County, dial 988, they would have an opportunity to be connected with the mobile crisis response team. And through our house and sales tax, we have funded it $20 million to build it up with the staffing. Now, the update I got today is of the 70 some odd positions, we've only filled 7. So police at this point, and it's really important, are still gonna be needed for quite a while now for those who are in crisis, rather than waiting sometime and letting it escalate. The AB 988 was in answer to the Miles Hall crisis line, and we're going to have in Concord at the Oak Grove site, we're going to have the Miles Hall hub. So family members, it's only in mental health where a person has to wait until it's at its worst to get help. We want preventive services. So we'll have an opportunity that Town Hall didn't get, which was when Miles was compensating the day before, she had to wait until he met that criteria, 5150. But what if we had preventative and she could take him there, or she can have someone come out to her home who's either a licensed clinical social worker or a family member or a peer. So Seneca has been doing these services for children for such a long time, and they've had ideal outcomes. And so now we'll have that available for adults, but we don't want people to get confused, because that governor still has to sign off on what we're now calling AB 988, but will be the Miles Hall Suicide Prevention and Mental Health Emergency Act. Thank you.
Wonderful. Thank you, Gigi. Are there any things that, because I know we want to find out the best way to get that information out to the community and to community members. Is there anything, this is probably to you, Mayor Harris, or maybe you, Manager Catalano, anything that our local leaders could do to help give more support and, get that word out even more so?
Well, we can certainly put it on the city's website and also feature it in an upcoming issue of our City Outlook magazine. I think it's very important that that members, not just the Pleasant Hill community, but the entire Bay Area community, understand the significance of this non-emergency ability to get help if you're in a mental health crisis. And the more we can do to provide that information to our residents and others, I think will go a long way, hopefully, to keep people who are potentially in mental health crisis from doing harm to themselves or others.
Great, perfect. Wonderful, thank you. Any other responses? Okay.
I want to speak to that just because at NAMI, we created a law enforcement brochure, resource brochure, and we get copies, I'm pretty sure, that Pleasant Hill. But if someone is involved in domestic violence, it's my understanding that law enforcement is mandated to leave information about how they can get support for themselves. So we found it was important also for individuals after a 5150. Too often, well, more often, individuals, cops, social workers don't deem that the person meets the criteria. So they leave the family or the individual without any resources for what now. I might not meet the criteria, but I'm still, having an emergency. And so our brochure is designed to give the resources that the individual might need. And we have made those available for law enforcement agencies to give out, because imagine if your mom called for 5150 and the police didn't take you, what happens, personal experience, when they leave. What, there you go, thank you. Yeah, Pleasant Hill, Mayor.
We
and
keep them on hand at all times.
You guys are ahead of the game in so many areas. Thank you.
And I'm presuming, Jeff, that we could have a link to that form and other services on our city website, where we're talking about the 988 phone number. I presume that we can link that so that we make that information readily available to anyone who is interested.
And we've updated the brochure with the information about 988, and we also have it in Spanish and Mandarin. Thank you, Leo.
Perfect, wonderful, thank you. Another question that came in, how is, this is for you, Sergeant Anderson, how is the CIT working with, specifically working with the local community?
The CIT program officially launched back in February. So with trying to get the program started so that we can respond to different areas, we got all the officers through enhanced training and through baseline training provided statewide and locally. And so now what we're trying to do, the team leaders are actually trying to reach out through programs like this to community leaders through other programs so that we can begin to get other perspectives that don't necessarily come from a standardized training model. We have vendors who do all kinds of different training, implicit bias training, crisis intervention training, but really, that is not agency specific and it's not area specific. So we may be hearing something that nationally has an impact or nationally is important, but we're trying to find areas locally where we can have members of the community or other groups come in and speak to CIT officers and leaders and see ways that we can improve and actually give direct input to officers themselves. So I'll be leaving my information for anybody who wants to reach out to me, and we can help coordinate and have them attend. We have quarterly trainings so that they can actually get a direct line to us. I know Gigi has spoken to police leadership before, and these pamphlets being one of the outcomes of that has been a huge resource, because there are times where, because the 5150 threshold is so high, and because we appreciate the impact that it has on people's lives, sometimes we don't feel people meet that criteria. And like we said before, the people are kind of left wondering, what now? So that's what CIT is really designed to do, is to help bridge that gap, help educate people on what they can do next. Because we are trying not to leave scenes with people with questions. We're trying to help educate, because enforcement is a huge aspect of our job as police officers, but education is also rallying for a very close second place there. So.
Perfect. Thank you so much, Sergeant Anderson. And now this question is directed to our students specifically. How has COVID-19 impacted / changed your life and those around you?
Hi, COVID has impacted my life greatly, since it has come into everyone's lives. For 2 years, I feared that my loved ones would get COVID. I feared that I would give it to them, so I isolated myself from some of my family members that I really miss seeing, and it's definitely kind of harmed the relationship that I used to have with them. So the connections that I once had aren't as strong as they used to be. And without having a solid support system throughout the pandemic, because I had to be so isolated from everyone, it definitely took a toll on my mental health. It exacerbated my anxiety, my depression. As Gigi stated, it was social distancing instead of physical distancing. So, that meant that people weren't even really reaching out to each other, making sure that, our mental health was still good. We just all assumed that, it's going to be for a couple weeks and we're going to get back to work and back to everything as normal. And look where we are. I mean, it's definitely taken a toll on my loved ones' mental health as well. We're all just in a constant state of just that fear that lingers with everything surrounding the pandemic. You still think about it when you go to the store, you still think about it every single day, and it's going to be like that for a long time. And I can definitely tell that the students that I was in class with over an online school, I didn't even go back to San Francisco State for I only went for one class for my entire undergraduate career there. I only went there just recently just to finish up some classes or one class, and then the rest of it was completely online. And that was definitely something that I was not expecting when I went to college. I was expecting to have 4 years of intertwining myself with friends and making connections, and yet I did it from my own home. So it's a different experience. We're the first to have gone through it, and being that I have gone through it, I can definitely give some advice and some help to others who are just now stepping into the realm of college and online and socially distanced learning.
Wonderful. Thank you so much, Tristan. Other students?
Yeah, for sure. I would like to add on with like what Tristan just said. Like this pandemic's like really cut off all the connection we have with our family, with our loved one, with our teachers, or like as a student, like with my parents, with my like other friends, especially like my work. I feel like it's just kind of a missing opportunity besides what Tristan just said. Like it's like increasing the difficulty of connecting with schools, with work. Besides that, it's like missing out opportunities. Like I remember back in days pre-COVID, we would have a lot of like field trips or like so much opportunity to learn, to like explore yourself, to like learn what your dream work will be, what's your dream, and like how do you want to achieve your dream. But right now, all of that are gone. We don't have the opportunity to go out with my student, with our as a class. We don't have the opportunity to like work at maybe in person. Instead, it's all online, the study and the work and all of the stuff. It's just so hard for every one of us. And especially, I was test positive like in January, and I self-quarantined myself for like 21 days. Those days were the hardest time. I was like just locking my own door, just like looking at the ceiling all the time. It's so hard, especially for those people who are living with mental health conditions or problems. It's just so hard. So I think being experiencing all those experiences, I can help others a little bit when I share those experiences. Maybe I can talk to them, connect with them a little bit. So definitely COVID-19 impacted my life a lot. And to be honest, I couldn't even remember the life before COVID. It was like, it was a long time ago. Thank you.
Well, thank you so much, Leo. Tara, Alexandra?
Yeah, so I also had increased spike in anxiety and depression. I was supposed to start at Loyola Marymount University in the fall of 2020, and that obviously did not happen. It was something that I worked really, really hard to transfer to a good school, and I wasn't able to go that first year. I ended up doing everything online because or doing just a few units online, not a full schedule, because I didn't think I could handle a full schedule online completely. And also I wanted the experience of going to school. And also during the pandemic, I was nannying / tutoring kids in my neighborhood. And I noticed that they were just, the socialization that they were supposed to be getting at that age, it was definitely, the pandemic definitely, held some people back regarding that.
Great, thank you so much, Alexandra. How about you, Tara? What was high school like?
I was in college for all.
Okay.
I left my dorm my freshman year when we were supposed to leave. Was gonna, leave for spring break soon or something. And then it was permanent. When everybody moved out, it was so sad. And then I was home for a while, and it was just so not what I was expecting my college experience to be at home. I did find an apartment later. I did get to move back in with my roommates. So I didn't experience as much of the isolation as I could have if I were just like in my high school bedroom with none of my friends around me, afraid to leave the house, which was a lot of that time. But it's still just so hard to get through the day when you know that there's like people that are sick and dying all around the world. I had a lot of just general mental health issues during that time. I was going through like deep depression, getting panic attacks, paranoia about everything that's going on around me. And so it was just, and it's such nobody's gone through this. I don't know who to talk to about everybody's going through the same thing, but it's like nobody has been through this historically. So it was just generally such an anxious time. School was so hard. I never expected to have to do school online, to watch like videos instead of actually making connections with real professors and TAs and stuff, like watching their pre-recorded stuff from last semester and like going into breakout rooms on Zoom with other students that like I had never seen before in person, and like oftentimes just not learning anything from one another because we don't know what to do. it was just, not what I expected.
Okay, thank you. Gigi, I know you have to move off to another meeting. Do you have any final words for us before you have to kind of
Yeah, I commend these young people who are still able to make their college, make it to college, and some even graduate, because some of the calls we were getting from some communities is rites of passage is really important to some individuals. You work really hard and you're waiting to get the letter from the college that you wanted to go to, or make a football team or a basketball team. A lot of individuals thought they were going to go pro, and then their college sports was just blown up. Some more people got into trouble. I mean, some groups of individuals economically were struggling more and kind of developed the I don't give a darn attitude. They got their lives off track because they felt so hopeless and defeated because of COVID. And so I thought it was really important to understand, like in the African American community, the faith community has been a protective factor. And for some young people connected to that, not having it anymore, being raised by a single parent and not having those deacons or those pastors to say, stay on track. We started getting quite a few people, unfortunately, who took the wrong path and had more contact with people like Sergeant Anderson, who never would have before, who like that was not the projection that they would be taking, but they had well, no one can tell me what my life is going to be like because nobody knows what theirs is going to be like. And so some sense of hopelessness has set in for some people. So opportunity to get them back on track. What we learned when we did a training at NAMI around how to support individuals who are in school and the distant learning, or I don't even remember. Yeah, I guess that's what we call it, distant learning. When they came back into the classroom, they were told, put those cell phones down. You're not supposed to do this. And so we asked the instructors, what did they need most? And they were saying time to readjust to a learning environment, relaxing some of the requirements that you may have had, recognizing the trauma that some individuals experience through job loss, through seeing their family members pass, because that was true for some communities. They saw a lot of death, and young people generally don't have that many people dying around them. So we've talked about trauma-informed care, but we have to look at the other healing and understand that individuals, I think someone said it earlier, around mental health, they're not the worst thing that happened to them. So really building people back up and reconnecting them to their purpose is some of the work we need to be doing now. So as you said, I have to leave, but I so appreciated having the opportunity to spend time with these young, brilliant minds and some of you leaders and protectors. So I'll sign off now, but thank you for having me.
Thanks so much, Gigi. Appreciate it.
Lloyd, if I might add something, during the pandemic, I was on the other side of the Zoom screen as a professor, and I saw how challenging it was for my students to interact not only with each other, but to interact with me. I teach in the Socratic method. I like to have people involved, the young people involved in the discussion, and it was really challenging. So I recognize the challenges that you young folks went through, each of you individually, but I also see that your entire core, whether it's high school or college, it was just such a challenge. And I admire you for making it through that and moving back to hopefully a more normal educational process, because there's nothing better than being in a classroom with instructors and students where you can interact, ask questions, get to know each other, feel comfortable about the material and the individuals. And boy, I saw the challenge, and I appreciate what you folks have had to go through.
Great. Thank you so much, Michael. So I think each of you students has kind of touched on this a little bit, but any other comments on the effects that the pandemic had on, maybe not just you, but like some of your friends or loved ones and things like that? If anyone wants to, make any comments in regards to that.
Absolutely. My friends and my loved ones have all experienced some form of anxiety or depression because of the pandemic, and looking at, exactly where they were beforehand. As Leo mentioned, it's really difficult to imagine life before the pandemic, because now it just seems like it's completely all-encompassing. And noticing how, some mental illnesses have honestly like come to fruition almost. So I was diagnosed with ADHD during the pandemic. I didn't realize that I even had that until I was doing socially distanced learning, and I couldn't keep my mind on the work in front of me for more than 15 minutes or so. And it was affecting my grades. And that actually happened for a few other of my friends, not necessarily ADHD, but there was some type of attention deficit happening with this social learning and everything being on our phones and our computers. And it even affects us when we're ordering food at restaurants now. We have the phones and the QR codes to scan the menus. So it's affected every part of our lives. And knowing that some of my friends genuinely didn't think that they had a mental illness beforehand, and seeing how now they are talking to therapists, they are describing these feelings of isolation that they had never experienced before. Some of them lived with parents who were older or even their grandparents, and it was impossible for them to even go to the stores. They had to Instacart everything. So just imagining how absolutely daunting that feeling of loneliness, those feelings of loneliness and depression must have been for them. It's no surprise to me that younger students, and especially in communities of color, it's no surprise to me that they are experiencing higher rates of suicide, depression, anxiety, because it feels like this is never going to end, and it feels like they don't have a way out besides, just kind of dealing with their mental illness, which can seem too difficult, and it can be too difficult for some to endure.
Great, thank you. Other comments from students?
Yeah, I'm super agree with Tristan. Just yesterday, like exactly 24 hours ago, we were having our TISP group, Transitional Young support group, and a young man just called in, just like looking for some help. And after the support group ended, he left over some extra time for me, and he just like have a mental health breakdown. I will not reveal his name due to privacy, but he was a 21 years old man, just like having a super anxiety right now. Like he's learning his driver's license and just like having so much problem going on with his life, and especially like money wise, he have to work part-time extra to like keep him living and her family and her loved one and his loved one. So this pandemic has created such pressure on him. So he was like crying for help, like looking for every help he can find. So through a helpline, he found us, like our NAMI Transitional Young support group. So he's here so we can help him a little bit. So my point is, there are so many of young men out there are looking for help right now, and we're not even close to helping all of them. They're looking for any possible ways that can help them, like support groups, like phone calls, or like therapists. And he mentioned to me like that he can't afford therapists at all, or like any mental health counseling part. It's just so sad to think about that. And especially this pandemic has created so many problems like inflations. It's just so hard to think about. So yes, there's definitely a big impact on mental health.
Great, thank you, Leo. Alexandra, Tara, any other comments?
Yeah, on the note of what Tristan was saying, I could name at least like 3 or 4 of my own friends from high school and from college that were diagnosed with ADHD after the pandemic began. So they'd had it all their lives. They just had no idea until learning went online and until they started having to like figure out new ways of learning at home, like by themselves. I have so many other friends who had so many other mental illness problems. I have a roommate of mine had to go through ECT, like electroshock therapy, because of how deeply exacerbated her depression, her anxiety, and her OCD, and so many other just mental issues she was having. She just needed really the strongest therapy she could get, because it gets so bad when you're so isolated, and you just get stuck in these mental loops of like not being able to accomplish anything and not thinking that you're able to accomplish anything. So just those are a couple of stories from a couple of friends, and there's so many others. Yeah.
Great, thanks, Tara. Anything else to add, Alexandra?
Yeah, so a lot of my family members work in the medical field,
Mm,
and I know that they were extremely stressed out and kind of overwhelmed with, like the idea that they could get everyone in their family sick if they contracted the virus. My own father, he's a dentist, and I remember I worked with him sometimes. I had to wear full PPE. It was just like the pressure in healthcare has just been astronomical.
great. Thanks so much, Alexandra. And I think you've kind of touched upon this for all the students. How specifically are you dealing with increased anxiety? And do you have any advice that you would give other specifically young people in regards to dealing with some of those issues that have come up throughout the pandemic?
For sure. I can name like several advice right now, but I can go like one by one. Since like, yeah. So the first thing I'll do is like to reach out, to seek help, like for your families and especially your friends. I think the number one thing you do just like to seek out. This is not a problem you have. It's just like something you're going through with. This is not a shame. So definitely like get out that stigma, something, just like seek for help. And the second one is like besides your family and friends, there are like a lot of more support groups that are going on, especially like with NAMI and other organizations. We have like support groups, we have classes to teach you, or even to teach the patient's family, like teach them how to like, get a nice and cozy environment for the people who are living with mental health conditions. So I think, yeah, there are plenty of ways. And I think you can like sort of get just like the 9A we mentioned about, and there are several helplines or warm lines, suicide prevention lifelines that they're on there. And on our website, you can find more like support groups and classes. So yeah, there are several resources.
Great, thank you, Leo. Any other thoughts? Tristan, go ahead.
Definitely. As Leo stated, definitely, reaching out is the first step. Acknowledging that help is needed is the second, or first and second, really. And I think that it's important to note how fast kids these days have had to grow up. We've been faced with literally imminent death if, we haven't prepared enough for going outside, wearing our gloves, wearing masks, and washing our hands as soon as we're done with anything. It's such a daunting feeling to feel like you're responsible for potentially getting your family sick. And I think that having those feelings is translated into really, I already used this word, but exacerbating the feelings of anxiety within us. It's so scary to go outside and not know what is going to come from that. So agoraphobia rates have risen as well. And I think that it's just an absolutely terrible thing for younger people to have gone through. I'm just thinking about even younger than high school and college aged kids and their mental health. My niece and nephew are 9 and 11, and they are not doing well with the socially distanced learning. So thankfully they're back in school, but it was really difficult to see them not enjoy school anymore when both of them had previously loved it so much. But they're both very social individuals. So having an entire year off from school when they were told it was only going to be a couple weeks affected them in their trust in adults as well. I've noticed they're like, they think that, what adults say isn't always what's going to go, because there was so much back and forth between, oh, put your mask on, take your mask off, it's okay now, oh, we got to put it back on. And, oh, you're going to be in school in a couple weeks. And then now it's a year and a half later and they weren't in school yet. So thankfully some schools are open again. It's important that our students are learning physically with the teachers right in front of them, especially younger than high school aged. High school age is a little bit more resilient, but we shouldn't take advantage of that resiliency either.
Tristan, real quick, just to make sure everyone knows, what's agoraphobia?
Agoraphobia is the fear of just basically any, like the outside. It is when you are scared that it's anxiety about every possible thing that could happen to you by going outside, whether that's a meteor striking, getting COVID. Your mind goes to the last absolute worst thing that could happen, and it kind of fixates on that. So instead of facing that fear and being able to leave your house, people are sometimes forced to be almost reclusive and sit in their own homes, and they don't have the confidence in the actual outside to be able to feel safe in it. And it's a really terrifying mental illness, and it's done a lot through exposure therapy. A lot of people can overcome some of the symptoms, but it does affect someone's daily life in more ways than one.
And obviously the pandemic has exacerbated, like you had said, exacerbated all of those type of situations. So thank you so much. Michael, did you want to say something? Yeah.
Thank you, Lloyd. First of all, I want to thank the young panelists. As I mentioned earlier, I think you're extremely courageous for coming forward and talking about your experiences. And I know what you've said is going to benefit other people. So I commend you for that. I also am appreciative of the fact that you're looking at re-socialization as a way to overcome some of the anxiety that's been caused by COVID. It's not just for you young people, it's for all of us. I spent 2 years not going to in-person meetings and what have you, and obviously I have a lot more resources than the young people, and it challenged me as well. Pleasant Hill has always been a welcoming and open community, and we're always looking for ideas as to how we can make things better for our residents. If any of you have any other suggestions as to what you think we might be able to do to help youth in the mental health issues, please don't hesitate to go onto our website and contact the council or the city staff. We certainly welcome your perspective as was well seen tonight. You folks are, you understand, you've been through it, and your experience is going to be obviously something that's going to guide you through the rest of your lives, but it's also a prime example to others as to how to make it through this very challenging time. And as I mentioned at the very beginning of this discussion, the last few years have been the most challenging time I've seen for students and for others. And the fact that you acknowledged the problems that you had and were able to work through them with the help of others is just fantastic. And I wish you nothing but all the success in the world in the future.
Great, thanks, Michael. Another question, I think we've it's been touched upon a little bit, but I can kind of combine a couple of these questions. What are some specific ways that the pandemic has impacted, BIPOC youth and also LGBT youth?
So more individuals in the BIPOC community have either died from coronavirus or have experienced more extreme symptoms of mental health challenges due to the worldwide pandemic. Resources aren't typically made readily available for these communities. They are very much so pushed aside, and they just are, they term it as, oh, they fell through the cracks. But let's fill those cracks and let's be preventative about it. And so fueled by isolation and loneliness, this community, the BIPOC community, has constantly been underserved. And it's just, they don't have much trust in the government itself because in the past they've been failed. And now it's like, why should we trust this vaccine? It's probably here to harm us. And, it's been part of my job at NAMI Contra Costa. It's been part of our Cal Hope program at NAMI Contra Costa to reduce the fears about medical health and just medical advice for the BIPOC community by showing them that, hey, we're all vaccinated, it's okay. We're all okay, and you will be too. And again, those feelings of isolation and loneliness, it's not been, or it hasn't been very easy for this community to reach out, as I stated beforehand, because of these resources not being made readily available for them. But when they do, there's a lot of stigma in each and individual ethnic culture. So especially for men of different, of different colors, it's difficult for them to reach out because in their family, a lot of times, and this is what I've heard from many of the youth and many of the individuals that we do help at NAMI Contra Costa, a lot of times it's looked down upon to reach out for help. You want to be this very stoic person. You want to show that you can handle your problems by yourself. You don't need anybody's help. But that's just not the case anymore. And we all need everyone's help. We all need to be supportive of one another. And it starts with supporting those who feel like they don't need the support. Just letting them know that we're here and that we understand them, advocate for them, and validate their feelings. That's just a few small steps to hopefully putting an end to this, I would say, what's the word I'm looking for? Just kind of inequality in mental health and in this healthcare system.
Great, thanks, Tristan. And just a clarification, by HAPOC, Black, Indigenous, people of color, just so everyone knows that. What about the LGBTQ plus youth? Anyone want to respond in regards to that?
Sure. I mean, the queer community was already at a higher risk for having mental illnesses, for suicide rates, for self-harm, just basically all of it. And so having this pandemic on top of that, I've personally had a lot of friends go through identity crises. Like, we're trying to come to terms with things like our gender, our sexuality, like our differences in our personal identities that we haven't had to deal with before. And in some ways, being online has helped with that. There's a lot more resources and a lot more communication about things like this that could be hard for younger people to talk about and to know about. But it's also, because of all the isolation, led to a lot of problems within the community. And I do not know where I was going with that, but sorry.
No, that was perfect. Thank you, Tara. Now I want to talk about, because I know we've focused mostly on the pandemic. What about some of the other things that are going on? Economic uncertainty, inflation, rising gas prices. How is that adjusted, or forced to adjust your relationships, your activities, etc.?
It has definitely affected multiple things in my life. As a young adult, speaking of inflation, where maybe my fiance and I are potentially looking to buy a house, but not anytime soon, especially in California. We've noticed that it's just going to be a long process that we'll have to save a lot of money for, and then saving money during this time is extremely difficult. We luckily got into an apartment that during the beginning of the pandemic, a lot of prices had gone down for renting, so we were able to sneak into an apartment that's thankfully affordable for us. But I couldn't imagine us, trying to move out now and seeing the rent prices. I mean, you're looking at $3,500 homes in Concord a month for just renting. And at that point, you're like, well, I might as well get a mortgage. So I am not, in this position to be able to afford that. And being that I have almost a full-time job, I'm still part-time, but I'm just getting almost to full-time, and saving money is extremely difficult. Food prices are rising. Groceries are more expensive than I ever remember them being. And to get from point A to point B is maybe $20 or $30. So it's difficult to go out and socialize. It's difficult to drive a car to work. You have to make sure that you have enough money to get to work. And there's just a bunch of just absolutely difficult things that we've had to go through. And then on top of it, now we're very broke. So I really feel for everyone, and no one is alone in that sense either. I can't think of one person in my friend group who is financially and completely stable right now.
Thanks for sharing, Tristan. Alexandra or Leo?
Yeah. So I feel like most people in our generation right now just feel kind of hopeless economically because we are told, hey, you need to go to college to get a good job. Well, we're going to college and then now we're getting out in the workforce and no one wants to pay us the proper amount. And just as Tristan was saying, like housing costs, food costs, everything is just so expensive. We can't really build a comfortable life in this economy, with how the things are, and with the just economical problems that we've had in the last few years. It's just like every time something happens, we just get more and more stressed.
Yeah,
Thanks,
I'm super
Alexandra.
agree with Alexandra. Yeah. Oh, sorry. Yeah, I'm just trying to say that, especially for our people, like the people who are living with mental health conditions, we often have like more things to pay. Like you have to pay for like therapists, you have to pay for like training sessions, and they're not cheap. And especially under this, like everything is pressing us up a little bit. You have to pay for gas to run to the therapy section. You have to, pay more. It's just more and more pressures. And eventually, like we are the first people who like to have a mental health crisis. We are the first people to have a mental health breakdown just because we can't afford it anymore. So I think, yeah, it does have a big impact on us.
Great, thanks, Leo. Anything to add, Tara, at all?
I mean, all of that is just another source of stress for everybody, like, especially because most of it, like at my age, at least, most of me and most of my friends are making minimum wage right now. We don't have our degrees and we don't have any like specialized abilities. So paying for anything is always hard. It's like, I cannot go out to eat. I'm sorry, but I just have to pay for gas, unfortunately. And then there's like all these supply issues that are adding more stress. Like I'm worried about, I don't know, this is more just me being worried about things in general, but I'm worried about in the coming months not being able to have access to as many things because of both the climate crisis and everything else. But it's just having economical issues on top of that. There's no peace out here.
Thanks, Tara. Sergeant Anderson, have you noticed anything in regards to, people struggling so much more? Are there things that you're seeing throughout the community where you see people struggling so much more and it's affecting other things where maybe that hadn't been the case in the past?
I think the calls coming in definitely have increased when people are in crisis and or trying to deal with something, or having a family member or a friend who's trying to deal with something that they're going through, whether it be a mental health disorder or illness, excuse me. And the self-medicating is really the thing that I've seen a lot within the community, is that people reach a point so much more quickly now where they're frustrated or they're at their wit's end and they're going to self-medicate, and they choose whatever substance they choose to medicate with that is going to do a lot more damage than it is good. And then that's where we get involved. But I feel like that timeline has definitely shortened down quite a bit from what it used to be. So people go from A to Z a lot faster than they used to.
Great, thank you so much. Mayor Harris, are there things that maybe the council is talking about, doing, anything possible, maybe more affordable housing, or, finding other ways to kind of make things as balanced as possible? I know it's, obviously it's extremely expensive living in this area, but are there things that the council have talked about to kind of, lighten the load for folks at all?
Well, I think you mentioned the one thing that the council does have some control over, and that is housing. We're constantly looking for opportunities to provide affordable housing to not only our residents, but to folks who want to live in our wonderful city. We don't have much control over the economy. I can't set grocery prices. I have nothing to do with the price of gasoline. We certainly are putting our money where our mouth is and trying to provide services, as you've heard, through Sergeant Anderson and others. We have worked with groups to help the homeless. So we're aware of the fact that there are folks out there in our community who need additional help, and we're trying our best to do that. We're constantly looking at new opportunities to provide affordable housing. We're in the process of finalizing our general plan for the next 20 years or so. And I think you're going to see in that particular document that we're looking at opportunities for both affordable rentals and affordable homes. I wish there were more that the city government could do. We just don't have the resources nor the wherewithal to do much more. Certainly, if there are things that any of our panelists think that we might be able to do, or suggestions that the folks who are watching this think we should do, provide them to us. We're always willing to listen. We're always willing to look at whatever else we might be able to do. But again, we're very limited as a city government as to what we actually have control over, even though some people think we have control over everything. That's not the case at all.
Yeah. Great. Thank you so much, Mayor Harris. Now I want to, because I know we don't have too much time left, but I want to, kind of expand out to a question in regards to kind of more national politics. This is for our panelists, of course, have changes with, for example, women's reproductive rights at the Supreme Court level had an impact on your life or lives of your friends or family, or do you see that having an impact on their lives at all? Roe v. Wade.
Hi, I definitely do. Yeah, it took a toll on my mental health, honestly, just because I was so scared for not only my own future, but also for potentially like my children's future or my niece's future. The autonomy that we deserve, and that is in, it's not necessarily I just took a history class as a final general ed class, so we talked a lot about this. And within the 14th Amendment, the right to privacy, and also in the First Amendment, many think it's just the freedom of speech, but it's actually the freedom to choose what you would like to do. There's many different facets of each amendment, but this specifically goes against both of them, because the topic and the reason that many of these officials and elected officials have decided or have based their ruling upon is that it's against God's will, and nothing against religion at all, but it does not have a place within the Supreme Court rulings. It does not have a place when deciding the medical and healthcare procedures and practices that pretty much half of this population is allowed to have. So, when we go into the right to privacy, the right to have the freedom to choose which religion that you would like to practice, it shouldn't come to an end as soon as someone needs some kind of controversial healthcare, and no one should have to disclose their healthcare or be tried for it. I mean, it just seems like it's a ploy to cause further disparities within communities, in impoverished communities, because not many people are going to have access to safe abortions. It's the reality of the situation, and it's not about people having the right to an abortion. It's the right to safe abortions. And if the general thing is, if you don't like them, then don't have one. And if you don't like them, then just kind of mind your business. And a lot of times we get a lot of people sticking their nose into things that it doesn't belong into. And it's a very challenging thing to go through as a young woman with so much uncertainty, and it makes me scared for communities in the LGBTQIA+, and thinking about how this could impact other bills and legislation that is passed in their favor.
Great, thanks, Tristan. Any other thoughts?
Tristan basically said it all. But I mean, it's just, I am scared for every single woman out there because, I mean, if someone were to get pregnant and they had an ectopic pregnancy, nothing can really be done now. If people with other medical conditions that would increase the risk for pregnancy don't have as many options now. And it's just, like Tristan said, access to safe abortions, it shouldn't even be politicized. It has nothing to do with politics. Women's bodies don't have anything to do with politics.
Thank you, Alexandra.
If I might add something, Lloyd, from what I've heard from these four young people, they're all active and caring, and I hope you continue to do so as you get older. Certainly, if you are interested in learning more about the law school would be a great place for you to go, and you could use that information to help change things, find candidates and issues that you believe in and support them, and make your voice be heard. Make your voice be heard. It may be frustrating at times because you don't think people are listening, but believe me, there are people who are listening, especially to young people like you.
Great, thank you, Mayor Harris. So I know we just have just a few more minutes left. I'll just throw one other thing out, one other quick topic out before we kind of finalize things up. Have environmental changes or challenges affected you, family, friends, fire, drought, other natural disasters? Any thoughts on that?
Yeah, for sure. I can start us off. So as all may have noticed, like the heat, like in this summer, it's like being extremely high. And to be honest, I'm not comfortable with that. It's like just 3 days ago, there's like a fire on the highway, and it leads like all of our schools like to close the AC down, just like to protect us from the smoke. And like all of us can't enjoy it anymore. It's just like the temperature is going so high. So global warming is definitely a topic. And I think we need to really have an issue on that. We should just focus on this. We don't want like our children, like maybe our grandchildren, to live like world with full fire and it's like high temperature. So definitely like global warming is a big topic we have to talk about. And besides pollutions, so right now I'm in a chemistry course and I'm studying a little bit about pollutions, about heavy metal and dyes. So it's getting everywhere. Like if the factory get the pollutions out into the water, the fish can like absorb it and we eat the fish. So the pollutions are going to ourselves again. So it's a topic we can never avoid. And I think we really need more attention on this.
Great, thank you so much, Leo. Any other thoughts in regards to that?
If I may just add one closing thought on this, Lloyd. My generation obviously has not done a really good job when it comes to saving the environment, even though many of us have tried. It's up to you folks in your generation to do so. And again, just as advocating for political issues or candidates, be strong advocates of the environment, whatever organizations and groups you can be involved with, and make sure that you have a great deal of influence. You may not believe it or not, but you have a lot of influence on not just folks your age, but on the rest of the population. We look to you as our future leaders. And there's no reason why you can't start as young as you are right now and just continue. And as I said earlier, I see very bright futures for all of you. And I'm hopeful that each of you will make a contribution that will help make our country and our city even better than it is now. And Lloyd, before I forget, I want to thank Sergeant Anderson for his work and the rest of our terrific police department. I want to thank you, Lloyd. And I want to thank the rest of the Diversity Committee and the Civic Action Commission. This series of conversations has been, I don't use this term lightly, it's been eye-opening to me. I've learned a lot from all the panelists and all the various conversations we've had, and I look forward to the next conversation. And I want to thank you, Lloyd, and the rest of the Diversity Committee and the Civic Action Commission. And again, my sincere thanks to the panelists for all the input that you've had. It's really been impactful. Thank you again.
Perfect. Thank you so much, Mayor Harris. Do any of our panelists have any final words before we kind of close things out?
Yeah, Lloyd, if I can.
Nice.
I just wanted to say thank you to everybody. This is the first opportunity I've had to participate in one of these conversations. And like Mayor Harris said, to the rest of the panel here, you guys are heard. This is the first opportunity that I've had to interact with people who, may be dealing with a mental illness, but not in crisis, or in need of my service in some way. So it's nice to get out in front of things, and I'll definitely take this conversation and this link and share it with the rest of the CIT team so they can start to kind of get in on these conversations and start to understand different perspectives. I think that's a big thing in law enforcement that we've been trying to embrace is understanding that not everything is just going to fit into a box. It's not going to fit between the lines, and that we need to be flexible and adapt, and that we are listening to what everyone is telling us. We still, unfortunately, do have some rules from time to time that we have to follow, but we are listening to what you guys are saying, and thank you guys for being so brave and sharing.
Great. Thank you so much, Sergeant Anderson.
I just wanted to say thank you to everyone for having us. This was a wonderful, wonderful opportunity, and I'm so thankful to have met all of you and to know that you are all so caring and progressive in the sense of mental health advocacy and prevention. Sergeant Anderson, thank you so much for taking this opportunity also for and to understand and, like you said, see people who are not necessarily needing your services right now. And it's a lot of times I feel like we associate the person as the mental illness, but people and mental illness are very separate. There's the person and then there's the mental illness, and sometimes the mental illness creeps into how the person acts, and we just have to find the root cause of things. And as Sergeant Anderson said, this is not a one-size-fits-all healthcare topic, or mental health is just not one size fits all. It's very, it needs to be detailed and tailored to each individual. So having these different communities of color and understanding that there are different needs for each community and in the LGBTQIA+ community is very heartwarming, and it's inspiring to see. So again, thank you so much, and I really, really appreciate it.
Great. Thanks so much, Tristan. June, did you probably want to say anything?
No, but I certainly want to thank Sergeant Anderson for really summarizing very well how we hope to deal with a number of these issues. And we have a really wonderful police department, and they are very aware of a lot of the issues that do occur. And we're very proud to have such wonderful people who can address issues so well.
Great, thanks so much, June. Well, I would just like to say thank you very much again to all of our excellent panelists. You're all amazing, and I think, as I think Mayor Harris said, these have been extremely eye-opening. We have a wonderful community in the city of Pleasant Hill, and I know, just having the opportunity to have these conversations, they make our community that much stronger. And so I appreciate all the continued support that I know I continue to receive. My family and friends continue to receive from Pleasant Hill. So thank you so much to Mayor Harris, Sergeant Anderson, Manager Catalano, and obviously all of our students, and Jeff as well, to making the city of Pleasant Hill such a wonderful place. As a reminder, today's webinar will be posted on the Civic Action Commission diversity webpage at www.pleasanthillca.org/diversity. And I know we weren't able to get all of the questions today, but obviously this is we will continue with these conversations in the future, and with obviously all of our wonderful panelists. Be sure to look out for more information on upcoming conversations, activities, etc. And please stay safe and healthy out there. Thank you once again for attending the community conversation on the youth. And we will see you out there in Pleasant Hill, enjoying all the wonderful things that it has to offer. Thank you again, everyone.
Thank you all.
Good, there's Matt. Have a good night, everybody. Thank you.
Thank
Thanks, Lloyd.
you.
Good night, everyone.
Thank you, everyone.
Thank you.